The pandemic ushered in a new era of telemedicine, and since then, there has been a huge surge in getting your treatments virtually.
Yeah, so here to talk more about its impact on both doctors and patients is our 9 News medical expert, Dr. Pyle Coley. Dr. Coley, thanks for being with us. There's a lot to consider when talking about this.
It's completely changed the landscape of medicine and how we think about it. And, before the pandemic, there was a minority of doctors using telemedicine, and now it seems like not just most hospitals and clinics, but most patients have had experiences and positive experiences with using telemedicine.
So as a patient, I've used it a few times. I can find such benefit in it, but how do doctors really feel about telemedicine?
I like it, and I think it's a really great way to access the patient where they are, in their house. And, my elderly patients, especially those that have mobility issues, I can see them every week if I want to see them, and I get to see how they live. And so sometimes understanding the patient's environment and sort of, what's going on at home really does help you deliver better care. But I have to say, it's a double-edged sword. Yeah, because as a physician, it's incredibly frustrating to lose one of the most critical pieces of my examination, which is the physical examination. It's not just what the patient tells you, but in medical school, they used to tell us it's called the eyeball test. It's how they look, how they sound, what their pulse is. If somebody comes in with dizziness, if their heart rate is 50 versus 150, that's a huge difference. And now we're relying on patients and their interpretation of the data and the information rather than sort of getting it independently. So you can really make mistakes in how you manage your patients because you're getting their version of the story rather than being able to check it yourself.
And it's so funny because you and I are opposite of that. Like, I don't like telehealth because I can't describe my symptoms very well. I'm not good at that. So I'd rather somebody be able to physically assess me and tell me what's wrong. Aside from just being able to see how somebody lives, what are some of the real advantages you do see from telehealth?
Cost is a huge one, Jordan, because we talk about delivering healthcare and doing it efficiently. And all the overhead costs of running an office, a brick and mortar office, that really does drive up the prices a lot. So I think that's going to be a huge advantage when it comes to certain patients and certain conditions. But again, on the other hand, it's not just the examination, it's my ability to do an EKG. It's my ability to order other tests, and it's my ability to understand the patient in their entire context. And if you think about how we use telehealth, there's sort of two models. One is our chronic primary care doctor that we need to check in on something for. We need a refill. We have a chronic complaint. That's quick, that's easy, that's a great way to use telehealth. When you have an acute complaint, you have a urine infection, you have a cough, that is not an appropriate way to use telehealth, and many of us do end up doing that because they do need to examine you and they don't have some of that context of your medical history. And a cough could be something as simple as heartburn, but it could be something as significant as a pneumonia. So that testing and that examination really does provide a lot of information.
So what's the warning that you have for patients if they want to go the telemedicine route?
I would say a couple of things. The first, do your research. You don't know who you're getting on the other end. You don't know what their credentials are. You don't know what their background is. And this doc in a box, as we like to call it, is a really dangerous way for us to consume medicine, as convenient as it is for many of us to say, oh, let me just get online and pay somebody $100 and get a visit. That is not an appropriate way to do it. Second, make sure you have a follow-up plan, because if they give you an antibiotic and you have an allergic reaction or some horrible thing happens, or they miss a diagnosis, and we often talk about this in our medical circles. There was this woman who kept getting antibiotics for urinary tract infections from her doctors at telehealth. Every other month she would get an antibiotic. Nobody was putting the picture together. Why is she having recurrent infections? Because she saw a different doctor or nurse practitioner every time. And she ended up having raging diabetes and got resistant to all the antibiotics. And so these types of lessons teach us that just kind of consuming medical care where it's convenient to us for acute complaints can actually be detrimental.
Yeah. All right. Very interesting. You got to weigh all the pros and
Again, a
cons,
lot to
for
consider
sure.
when you're talking about this. Dr. Coley, thank you.